Tonight we're going to be talking about the equine eye, but predominantly how uveitis affects the eye. And Master Jack is a name of a product of ours, but it also comes with a story. We have another horse and another story. Master Jack was a horse of a good friend of mine, and the horse was 5 years old, chestnut quarter horse, gelding, and he was recently diagnosed with equine recurrent uveitis or moon blindness, which occurred shortly after a chemical deworming. But I also know that the horse was not on the best diet, but I do believe that it was a combination of both. The treatment at that time, topical application to the eye of steroids, and then oral administration of aspirin in the food twice per day, 5 grams per day. So I was brought in to kind of initially help my friend understand what uveitis was, to help applicate the ointment, and we were doing this together. And applicating things to a horse's eye is quite challenging, and in this particular instant it was a long-term treatment. Back in 1996 it was my first introduction to uveitis, and so while we're treating this horse, I'm also at the same time trying to develop a product to, one, reduce the inflammation so we don't have to get upset digestive tract with the aspirin, to have alternative means to the steroids to help prevent another occurrence, to support immunity, all of these things. I'm just trying to throw things together to try and help this horse and to try and help my friend. It was a very good learning experience, but I hope that uveitis is something that you or your horse don't have to go through. This is a picture I got off Guardian Mask. I liked it because it just showed you how little, I don't want to say how little the brain is, but it is little in horses, but everything is just so compact here up above the eye. You have the ear canal and the brain, these nerve systems that run down and around the eye. So I just kind of wanted you to get a visual there. Then the next picture is going to be a side view or a dissection of the eye to help us understand what's going on when we have an episode of uveitis. This was a best picture by Dr. Robin Peterson. Had most of the things very clearly indicated and pointed to the aspects of the eye that we were going to be interested in this evening. So uveitis, anything with ITIS on the end indicates inflammation. So we have recurrent uveitis. It involves the entire eye in the end, but the beginning is just a uveal tract. And we're going to go over the anatomy of that. Tissues that line the part of the eye behind the iris. And the iris, if you want to look over here, you have the cornea coming in from the left-hand side. You have the cornea, the anterior chamber, then you have the iris there. And then we're not going to address anything beyond that for right now. The uveitis is composed of the iris, the ciliary body, which is kind of this yellow on both sides of the eye, this yellow area here, off to on the top and on the bottom of the lens and the cornea. And the choroid, which is also wrapping around the eye here on both sides as well. It's kind of providing a protective area to these frontal portions of the ocular area of the eye. So the membrane that surrounds the eye, which is the choroid, And also this tapetum, which is up here, which is a membrane layer or covering part of the choroid. And that is the outer posterior vascular coating of the eye. Vascular means we have blood vessels running through there. That barrier also serves as a barrier to immunologic responses, so things to protect the sensitive area of the eye, or the inner chamber, this chamber in front of the eye. Surfaces from the eye, also where there can be pathogens introduced. So the uvea is really the protection of the eye, and either from pathogens or other things that would be carried in from the vascular system of the eye. And it also produces and removes the aqueous humor, which is the thick, watery substance that fills the space between the lens and the cornea. Nutrition is provided through there. The immune response is provided through the uveal tract. There are the blood vessels. And if we have anything else in the body, systemic, that is affecting circulation in the body, unfortunately it can also affect the circulation of the eye. And we'll get into a little bit of that later. During uveitis, the iris sphincter muscle contracts to cause the pupil to close. So this area here is going to become small. There will be the ciliary body muscles will begin to spasm as they're closing this area, closing the pupil. And when that happens, there is severe pain. And you will see the horse squinting as well. The uveal tract blood ocular barrier, which is the choroid, the tapetum, is what prevents large molecules or cells entering into the eye, because it's that area where the aqueous fluid is being kept clean and free of pathogens and other debris. That's what the uveal tract is most of its job, is protecting that eye. It's when that barrier is disrupted, either by trauma or by inflammation or something that the blood has allowed into this protective area, like pathogens or cells, any cell that is not supposed to be in that area and that is not supposed to be entering into the eye. So something bypasses that protective barrier. Then what happens is that we have immune response. Antibodies are produced, and they unfortunately begin attacking the horse's own ocular proteins in the eye. So it begins attacking itself. These foreign antigens that are entering in the bloodstream, like such as bacteria or virus, we'll get into some of those later, enter the eye through our ruptured protective barrier. These antibodies also accumulate inside the eye. So there's a bunch of stuff going on in the eye that's not supposed to be going on in the eye, creating this inflammatory response. So the body is trying to protect itself and at the same time is attacking itself. So we're seeing somewhat of an autoimmune response as well. Now, when it comes to uveitis, there is a difference between uveitis and recurrent uveitis. You can have a horse that's diagnosed with uveitis, and it can be just due to a trauma, and it's a one-time incident. And you treat it, and there shouldn't be any incident of it reoccurring. But recurrent, or ERU, equine recurrent uveitis, is where we have the challenge of either bacterial or cells still being maintained in that chamber, but we can't get at it. The immune system is compromised, so we're going to get into that as well. A horse is not considered to have ERU until they have 2 or more episodes, and the initial episode can affect just one eye, like it did in Master Jack. Both eyes, though, can be affected. And even on a reoccurrence, it can be one or both eye. And if just one eye is affected, the other may become inflamed later. So the goal is to obviously not to get your horse's body and diet, immune system, and digestive system, and everything getting back up to par so that it can protect itself from the body creating this type of response. Got a lot of this information by Dr. Gilger. Very, very good information. Now I'm going to be introducing a lot of pictures through this because I want to give you an idea of what we're looking for. The treatment, the earlier that you can treat this disease, the better off you are. The less tissue damage you're going to have to the eye. So I wanted to provide these pictures on the top left. It's gone too far. We have some serious inflammation here, discoloration. Down here we have redness, but sometimes you just may get some redness around the eye, and that could be an indication. But I'm going to get into symptoms later, but I wanted you to pay attention to some of the pictures or photos that I have coming through this webinar. Each episode of uveitis is going to further damage the eye, and the uveal tract will become unable to protect the eye because there is damage to that barrier. Down here again is that picture of the eye that we were working on because I wanted you to have that visual as well. White blood cells, which are part of our immune system, settle in this anterior space. Let's see where anterior space here behind the cornea and in front of the lens, and that's what creates this kind of aqueous look inside the eye. As the disease progresses, a blood clot known as fibrin can build up in this anterior chamber, which is causing scarring to the eye. This can attach to the lens and iris, preventing it from opening under dark conditions. A subtle sign of this is iris darkening. If you want to, you really need to become familiar with your horse's eyes. It's as you go out and check, okay, his feet look good or the legs look good, I don't see any inflammation, I'm not feeling any heat, the hair coat looks good. You're just doing this once over, maybe while the horse is eating. It's going to be wise of you to lift your horse's head up and get a good look of his eye, what it looks like on a normal everyday basis. Once we do have an eye injury though, the sooner that you can get your veterinarian involved, the better. So you have this appearance of a chocolate color when you are looking into the eye. The retina at the back of the eye might become impaired or even become detached. And that's back here, the retina, if you can see that at the top of the eye. I'm pointing that out. Optic nerve, which is back here, becomes disrupted, causing loss of vision. We have obviously loss of depth perception. Each episode may last a little bit longer, and each time the eye loses a little more sight. There's more cellular damage. As the disease progresses, you have cataracts, which create that opacity of the lens. Glaucoma, which is where you have increased fluid or pressure on the eye. The eyes become misshapen sometimes. The retina may be affected with lesions or scarring, and certainly there's going to be visual impairment. So our goal, once you see some of the signs of uveitis or an eye trauma, is of course to preserve that horse's vision. We need to control the inflammation so that we don't have damage, tissue, cellular damage. We of course need to relieve pain. This is a very painful disease. And the earlier the treatment's begun, the better the outcome. Keep a journal. I say this probably at every webinar, but hang a pen on the barn calendar and mark any day. If you have a horse that's become all of a sudden diagnosed with uveitis, mark when it's red, tearing, squinting, and requires treatment, or if you're just beginning to notice some irregularities in one of your horses. But again, don't wait. Get the vet out. History. It was early. Equine recurrent uveitis was first or initially named in the 1600s, and they actually thought that these attacks were occurring and related to phases of the moon. Then the eye disease, also this eye disease might be one of the first veterinarian diseases ever documented. The pyramids, actually the pyramids in Giza in Egypt, there's depictions or carvings of ocular problems in the cavalry horses at that time. So 4,500 years ago, showing uveitis or a disease that is similar to uveitis. And then since the 1950s, there's been published reports that implicated leptospirosis in recurrent uveitis. We'll get into that too. That is a bacteria, widespread in cattle herds. The organism can persist in the soil for many, many years and lay dormant there, and your horse can get some of that soil and the bacteria into the eye. So if you know that you've had cattle or dairy cattle in that area, it also can come in from water. Here's some more photographs. So what to look for. Early symptoms are excess tear production or watering of the eye. Let's see, we have in the upper picture in the middle there, we have that spotted gray. This, obviously, we have an eye trauma, but some tearing here, and then that horse in the center. I don't see a trauma, but we have excessive tearing. Holding the eye shut, partially shut, squinting, or tightly shut. Down at the lower left-hand corner, this horse is obviously squinting. We have some inflammation here, and unfortunately we have an infection because there's some mucus or pus buildup there. Rubbing of the eye, redness. We see some redness here, but in that last slide, here's some redness here as well. Hopefully you can see my cursor. We see a horse that is avoiding light, like this chestnut here, maybe turning his head away from light. Pupil constriction, we talked about that earlier, how the pupil is spasming, it's closing. We have some white cloudiness, or even what you can see down here on the left, second picture up, or even a green tint. So you can have a blue or a green tint, and photophobia, which is, of course, sensitivity to the light. Other symptoms, head shaking, running nose, white spots or bleeding in the eye, matter or pus collecting, like down here in the lower left, loss of balance, tripping, running into things, not interested in grazing or eating, swollen eyes, like down here in the lower right. We have some swelling going on around the eye here that may be unusual. Spookiness, blinking, lots of blinking, and just being in bad humor. This is a very painful disease, so they're certainly going to be grumpy. Inflamed eyes are very sensitive to light. We've talked about that. Even low-level light can be painful. A vet exam will show inflammation of the inner structures of the eye. See corneal ulcers and things like that may have developed, but that's going to require some staining. So you want to get the veterinarian involved. Possible causes, trauma, cuts, or scratches. And if not treated early, you can have local infection, leading to then unchecked inflammation, that immune response in the eye. Corneal ulcers may be caused by fungus or bacteria that reach deep into the inner tissues of the eye. And when that happens, you have that inflammation and uveitis. Anything that causes a breakdown of that protective barrier, that uveal tract, the barrier between the body's blood circulation and the internal parts of the eye. If the eye is inflamed, how well the horse will respond to that depends on the health of the horse. Also will be a huge factor in future episodes. Once the eye is back to normal, we have cellular memory. I mean, cellular cells do have memory. Once you have that inflammatory response, this we see happening in laminitis too, after they have an episode, it's very easy for a horse to start having those cells respond in inflammatory response again, or express themselves. So once you have an occurrence of laminitis, or you have an occurrence of uveitis, it's going to be a strong chance that you're going to have another episode. Recurrent inflammation, how this disease progresses, the cause of the disease, what symptoms you're going to see, of course, vary from horse to horse. That's why I'm showing as many pictures as I possibly can. Here we're going to talk about leptospirosis, which is one of the most common infections and initiators of immune response. You get that into the eye, the immune system is going to kick up and start attacking the lepto. Bacteria can also be a possibility, so strangos, rhodococcus, borrelia, which is Lyme. Viral infections, influenza, herpes virus. Those are a couple that I have run across. Parasites in the eye, don't see a lot of that anymore, but it can occur. Allergic responses can trigger this in the eye. Heat cycles, metabolic changes, and then of course stress may actually induce the original some symptoms of uveitis, but generally these are going to be what's going to bring your second episode in if it's going to happen. Vaccines, deworming, transportation, a heavy schedule, anything that's going to compromise the immunity and make the body's immune system start to respond to the challenges. Systemic infections, endotoxemia, septicemia, anything that is affecting the entire body can then also affect the eye, also affect the foot, get us into trouble there. Whether horses with ERU still have active infection is uncertain. In other words, that lepto or some bacteria still may be present in these little spots in the eye, even though they've been treated with antibiotics, even though they've been treated with ointments and things. There may be some residual pockets that may trigger a response later. It is known that even the antibodies in these eyes that are directed against both the organism and the eye, we've talked about it, that this is also, uveitis is inflammation, but is also an autoimmune reaction. Here's some more pictures. Talk about treatments. Up here on the upper left, we have a couple people applicating ointments to the eye. And I had the pleasure of doing this several times, but I got very uncomfortable using these tubes. I was so nervous about the horse maybe moving and the tube getting into the eye, causing further damage. So what I ended up doing is sterilizing one of my fingers and then making sure that I rubbed the ointment kind of in the lower portion of the eye. You spread the eye open so that you can get into some of the inner pockets of the eye so the ointment can be absorbed in there. So we have topical anti-inflammatories, we have drops, antibiotics to protect the cornea from infections, other medications like steroids or buprenorphine and aspirin is utilized. If we have a horse that's rubbing because the eye is infected, it's itchy, veterinarians may prescribe an antihistamine or some type of medication to help to stop the itching. We didn't have that with Master Jack. Oral or injected steroids fight inflammation and the autoimmune reactions, but also weaken the immune system. But the goal here is we got to save sight, we got to stop the inflammation, so it's a tricky balance, and your veterinarian does need to be involved. Topical steroids. Let's see. Topical atropine, which dilates the pupil. This helps that muscle spasm and the pain so it prevents the pupil from scarring. Topical immunosuppressant drops like cyclosporine, this is where we're saying they don't penetrate deeply enough so that we can still have leftover infection in inner parts of the eye. And they help calm the corneal autoimmune reactions. And you can see one actually being inserted here on the left. This is an old treatment, but it's new for the eye. This will be the first time I've run into this here, but it's topical serum. And it's where you take the horse's own blood, excuse me, and you spin it down to separate the cells from the serum. And then you use the serum as drops to be actually put into the eye several times a day. Now there's been other stories where I hear where they take the horse's blood and then spin it down and then re-inject it back into the horse. But anyway, the serum contains substances termed growth factors that help with corneal ulcers in this particular situation. It helps with the healing of those. And they say the serum may also help control inflammation. Master Jack, once we got him on a good diet, we were doing topical applications. It did not get this severe with implants. Of course, I don't know how expensive doing a topical serum type thing would cost. So you have to talk with your veterinarian about that. Surgical procedures where we have removal of the gelatinous sac in the back of the eye, which will improve vision. This is where they have actually found leptoorganisms still hiding inside the ocular structures. And then, of course, we have removal of the eye. If we can't control the pain, is one of the main reasons, and we can't get the disease underneath control, then this is an option. So, Master Jack, wow, it took a lot of work, but there's a lot of stuff in it to help the multifacets of this disease, even of cataracts, the immune system. I put everything in here because I wanted to help this horse. So we have digestive support, obviously, if we're administrating topical or oral antibiotics, we need to get the immune system going. So, and the immune system, as we've learned in previous webinars, work very closely together. Have our energy pellets added in here too for tissue repair. Horses, when they're in a lot of pain, they use a lot of calories. They're using a lot of calories to fight the infection. We also have an amino acid profile in there to help with soft tissue repair. A lot of herbals. Vitamin A, of course, which supports eye vision, night vision, also shows decreased bacterial activity. Chelated zinc was really important here. Their trace mineral, this particular trace mineral, is found to be responsible for a lot of chemical reactions in the eye. So we use a chelated zinc here, and we chelate it here. B-complex vitamins, there has been studies that are links to lack of riboflavin deficiency to uveitis. So our B vitamins are stress vitamins. They help with nerve functions. They assist with light sensitivity, reducing of redness. But what else? If we have a horse that is short on B vitamins, what else is that telling us? It's telling us that the digestive system is not working properly. That's where some of your B vitamins are being manufactured, and it's in the large intestine where we have that fermentation process going on, which is why the ABCs Plus is in here. Ester C, which is it's a softer C. It's not corrosive or disturbing to the stomach. It nourishes that aqueous humor, that white liquid. which is notably to contain 18 to 20 times more vitamin C than actually what's in our bloodstream or the horse's bloodstream. Omega-3 fatty acids, stabilized flax meal is used as kind of a base in this product. Of course, it's a natural anti-inflammatory. If we're administering antibiotics or aspirin or bute or banamine or any of those things, it will, the fat in the diet will help with the adjustment of the pH and also protect the inner lining of the stomach. So that's why I've used, not only because of its anti-inflammatory effects here, is that even though a horse is on Master Jack, like initially the horse Master Jack was on, that provides that protective barrier in the stomach to some of the medications. Pre-digested humates, we need liver cleansing, also the trace mineral profile, carotene, which helps with eye weaknesses. Obviously, if we have a horse with uveitis, they were predisposed to an eye weakness. Organic apple cider vinegar, very good at pH balancing. Again, we talked in our electrolyte webinar how it's critical to keep the blood at pH, to keep the digestive system somewhere at 6.8 to 7 pH, and the urine to be at pH. So pH, and for the blood to work properly, to maybe reduce some of the pathogens in the blood, liver detoxification, that's why that's in there. Lysine is in here if we have uveitis in a response to herpes virus. We use lysine. It's an essential amino acid as well. And it doesn't matter, Master Jack, a question might be coming to mind is, well, my horse has uveitis and it was due to a trauma. Or my horse has recurrent uveitis and it was caused to a trauma, but then the trauma led to an infection, and so now we have infections. It doesn't matter how or what the uveitis is from. Master Jack is going to help. So next item is ions. You need cellular support. So hydration, healing fluids into the cell, bad stuff coming out of the cells. So cellular hydration is very important here. Jeremy's joint jolt, which is a lot of people are familiar with for arthritic conditions, but it's a great anti-inflammatory, helps with circulation, soft tissue repair. I use it a lot. Enzymes are in here, which is for cellular damage that's caused by free radicals. Blue-green algae. I use it a lot as a last resort in allergies. In other words, if I can't get a response with just diet and immune support with respiratory condition in horses, I will add to the diet blue-green algae. We have kelp and blue-green algae in, like for say it's in Plus and it's in Energy, but in this particular case I wanted to add a little bit more because it offsets vitamin A inadequacy. Detoxification, again, brings me enzymes and trace minerals, which is going to support the immune system. MSM, circulation, and Super Vitamins Plus is in here as well. A lot of you may not be familiar with Super Vitamins Plus, but it's a 21-day supplement. It's got a long history like Master Jack as well to support the immune system. It was put together as an alternative to antibiotics. So if we have a horse that is experiencing any type of infection, I use it a lot of times in cancer patients, melanomas, double the ABCs Plus and administer Super Vitamins Plus for 21 days, maybe some Probi. And if we have other injuries too, like to the hoof, to skin, I will utilize Super Vitamins Plus. And Master Jack might even just be a good thing, but Super Vitamins Plus is much more concentrated. So here we have the Guardian Mask, and they do this website I've been to several times, and it takes you into description of the mask and how it works and when to use it, it's a very good thing for these horses, or horses with eye injuries, or horses that, with any type of eye sensitivities. But the mask itself is a 95% sunblock filter. They mentioned Master Jack on our website. So with response from people who have bought the Guardian mask, they have input that the Master Jack has been pertinent or helpful in preventing uveitis, or preventing further episodes of uveitis, or reducing how long an episode may last, and even as a preventative. So you can read about the Guardian mask there. Some other therapies, we have acupuncture or acupressure, aromatherapy. Obviously you don't want to apply those into the eye. Work with someone who is familiar with those, that type of therapy. Chiropractic care, increasing circulation may be helpful. Something called cold laser treatment. I've never had to use that on a horse. I'm not even sure, I don't even know a whole lot about it, but there's laser experts out there. Bach flowers, though, I use a lot, and especially the rescue remedy. Again, you're not going to use this in the eye. It does contain some alcohol, but as oral application, it certainly help with the horse managing what's going on. It's a very stressful and painful situation. And homeopathy, homotoxicology even. So if you have a skilled homeopath or a skilled homotoxicologist, generally they're veterinarians, can help you on top of the Master Jack and the diet changes or diet support. So what happened to Master Jack? We just had 1.5 episodes. So the initial episode was, oh no, what's going on? What do we do? And how did this happen? And, you know, trying to collect ourselves and doing all of this topical application and managing getting him, because he was on a dry lot, trying to find a place for him to get out of the sunlight, trying to find a place for him to be comfortable. Oh, we've all been there. Not with this disease, with something else. So application of Master Jack is premix is 4 to 12 ounces. So you have a horse going through a response or an episode right now. You want to work your way up to the 12 ounces. Then afterwards you may need to stay at the 12 ounces for a little while. 4 ounces maybe as preventative care once you get over an episode, or maybe 6 or 8 ounces. It's really going to be dependent upon the age of your horse per se, how compromised that horse's immune system is, how severe the original episode was, some of those things. And so the dose is a little bit different for each horse, unfortunately, but 4 is generally maintenance, 12 is generally treatment. And the product, the way it looks, I kind of wish I had a picture on here. It's kind of a powder with pellets in it. So with Master Jack, we were able to reduce his aspirin into his diet from 5 grams to 2, and then it was completely eliminated. The topicals were also eliminated. He was on Master Jack indefinitely. Eye bright. I hear this from clients who call in calling for Master Jack, how great this remedy works or this herb works. It's astringent, anticatarrh, eye inflammation. I had somebody tell me that they just did a couple, 2 or 3 applications, and that helped tremendously with the inflammation. So I did use it on Master Jack. And if it didn't work, I wouldn't have put it here. So you don't want to use something with an alcohol in it, something because the eye is a very sensitive area. So we have somebody who made a tea here, and it tells you that they dipped it once it was strained and cooled, administered it with a cotton ball. Free choice stress system and white salt was honestly put out for Master Jack. He consumed a lot of the A mix, the BBC, and not so much the Rush Creek. He had a good source. We incorporated a good source of hay. His water was well water. It wasn't that bad. NOMS, of course, since we were not going to chemically deworm him again. And as I do recommend Horseman's Lab, there's this website there to help him, Dr. John Bird. I heard him speak at the Illinois Horse Fair, and he's familiar with alternatives and very familiar with parasite cycles, sends you kits and reminders. And we discussed our product called NOMS. It's not something that you want to, if you have a heavy infestation, NOMS is not something that you're going to want to use right away. So, but NOMS is used when you have light infestation or post-chemical treatment to kind of create an environment where you're going to help the horse's immune system keep parasite levels not excessive, or they won't be excessive. No-sodes. Another thing we don't want to try, that we don't want to do is react the immune system or agitate the immune system. And vaccines, that's somewhat what their responsibility is. So with these horses exhibiting autoimmune responses, overreaction of the immune system in reference to the eye, no-sodes are a good option to vaccines. And Dr. Gerald Wessner, and that's his website. And his website has good information on no-sodes. And I've been getting no-sodes from him since, oh wow, a very long time, maybe 15, 17 years. Stray away from non-processed foods, or I'm sorry, stay away from processed foods. And I used a high-fat diet, specifically our stabilized flax meal is what I use if I need additional calories above and beyond Master Jack. But a lot of times Master Jack has enough calories in it, enough flax in it, that it gives the horse the calories. But if I need to, I'll add additional stabilized flax meal to the diet, or other sources of fat like coconut oil, olive oil. You're going to want to use non-processed oils for the antioxidant, vitamin E specifically, which is good for skin healing, to be incorporated into the diet if that's helpful. So it looks to me, I got these pictures on the upper left here. It looks like somebody is riding with the Guardian mask. Tremendously in maintaining its life and its activity. In the middle, I just saw that picture and wished I was there. And the lower picture, of course, is where we've had the surgical removal of the eye. I have worked with 2 or 3 of these horses, 3 of these horses. Amazing how they have adapted to their environment. But the goal here is to treat early so that we don't have to progress to this type of commitment or surgery. And then adaptation, they can to adapt an environment with either partial or complete blindness in one eye. So, wow, I hope that helped you. Hopefully you haven't had to go through this, but if you've had, I hope this is helpful.
Great, thank you, Kendra. I'm going to go ahead and take the screen back and get some information up here for them. And just one question that came in. Lady has a question on if her horse is in between bouts, should she not remove the mask for any certain amount of time? Like for 15 minutes or so, will the sunlight help the reoccurrence come back more quickly?
Not necessarily. The Guardian mask people are going to probably, well, they're going to have, this mask has been around for a long time. They're going to have that type of answer for you. But the mask, when they're in a current episode, is really to help with that light sensitivity and that muscle spasm with the pupil protecting itself and protecting the eye with the muscle spasms, and so you're definitely going to want to use the mask then. Why this horse in this upper left-hand corner, the mask is on and it looks like they're out for a trail ride? Maybe, you know, it's wise if you know you're going to be, if your horse has uveitis, is not currently having an episode of uveitis, sunglasses. Just like we use sunglasses to put less stress on the eye. When you're looking into bright light, you put a lot of strain on your eye and the muscles, and I could see where long-term sun exposure could certainly set off another episode. Any questions on the Guardian mask, though, uses, how long you have to use it, when to use it, certainly ask the Guardian mask people. They are fantastic.
Okay, great. Thank you so much. If we have any additional questions that maybe you guys want to kind of ponder over the information that Kendra has presented to you, please feel free to email that in to us. You can email directly in at jgh